In this video, we are going to quickly talk about some natural treatment methods that can be used as a great alternative to taking medications for absence seizures, as well as other types of seizures and epilepsy as well. Now, one of the first methods that many people find to be extremely beneficial, and many studies have also shown that this is extremely beneficial and is often used on people with medication-resistant seizures. This is going to be the ketogenic diet. In short, this diet is a very low-carb, high-fat intake diet, which causes the body to switch its fuel source from using glucose for energy to something known as ketones, which are a byproduct that comes from our body breaking down the fats that we are eating in this diet. Now, this ketogenic diet has shown to be not only beneficial for children, but also adults. Now, while we are on the subject of ketones, another method that can be used is something called MCT oil, which is commonly derived from coconut oil. And like with the ketogenic diet, when our bodies are converting the fat into ketones, MCT oil is also converted into ketones, which can be a great alternative to the ketogenic diet. Though it is best to do this in combination with that diet, the MCT oil can be used alone by itself, and you can still expect to see beneficial outcomes. Now, moving on to another method that can be used. This is something known as the modified Atkins diet or MAD diet. And this is it's kind of like the ketogenic diet, except for it is much less restrictive diet-wise. Many people have a hard time sticking to the ketogenic diet due to its restrictiveness. And this modified Atkins diet has also shown in many different studies to be extremely effective at treating seizures. Now, another method that can be used diet-wise is something called the Paleolithic ketogenic diet, or paleo-keto diet. This too has shown to give great results for treating people with medication-resistant seizures. And like with the modified Atkins diet, it is much less restrictive than the full-on ketogenic diet itself, and perhaps could be a great way of kind of dipping your toes in the water, so to speak, instead of just fully jumping into a ketogenic diet, which is much more restrictive in regards to what it is that you can eat. Now, moving on to another method is CBD oil. Many different studies have shown that CBD oil is very effective at treating seizures. Unfortunately, it has been illegal for a very long time. For those of you who do not know what CBD oil is, essentially it comes from a cannabis plant or marijuana. It is non-psychoactive, meaning that it does not get you high, alter your state of consciousness or anything like that. And it is something that young children are able to take. And aside from many different studies showing its effectiveness, there are also many different videos on YouTube of people swearing by it, saying that it helped treat their children's seizures.
We started her on a low dose after I made the first batch of oil and got the lab test results back. The second day, she had a minor seizure. This was mid-November. And then after that, she has not had a seizure since. Even a subclinical? Nothing. We had her 17th EEG in January, and it showed no seizure activity at all. Nothing.
Wow. Without making this video too long, I will leave it here. Hopefully this information was quick and informative. And as always, if you guys have found this information useful, please help us spread this information by giving the video a like and subscribing to the channel. It will let YouTube know that people are finding this information useful and hopefully push it out to more people that could benefit from it.